Ever wondered what happens when two drugs are taken together? That's called combined effects of drugs that we are going to discuss.
Taking one patient is there. He is taking two drugs. One is drug A and second one is drug B. Now, with that combination effect, that A and B can affect each other in two ways. One thing is that one drug will increases the activity of another drug or drug B, or it can be that one drug will going to decrease or inhibit the action of another drug. So that two action can happen in combination drug effect. So according to that, how they are going to help each other or how they are going to decrease their action each other, based on that two mechanism, combined drug effect are classified into two. First is synergism. In that part I am telling you simply, here the one drug, that is a drug that will help in increasing the activity of another drug, that is drug B. And the second one is antagonism. What is that mean for? Antagonism mean for one drug, that is drug A, that is going to decrease the action of another drug. Here we are taking drug B. So in synergism, drug A is going to increases the activity of B, and in antagonism, the drug A will going to decrease the action or inhibit the decrease of drug B. Now we are going to details, or we are going to discuss in details about the different part of synergism and antagonism. The first one is synergism. By that name only you can understand, I just simply tell you in the last topic only. The synergism is one drug is drug A that is going to help that another drug B. That means that A drug will going to increases the activity or induce the activity of another drug, that is drug B. So that is synergism. That synergism can be classified into two parts. One is additives, second one is supra-additive. So what is the difference between additive and supra-additive? In synergism, I have told you that one drug is going to increase the activity of another drug. That means one drug will going to help in the action of another drug, that is drug B. Just suppose here the drug is A and B. So in additive synergism, what it will happen, here the effect of drug A and B will be equal to the effect of drug A and the sum of effect B. So in additive, what will it will happen, that effect of both combined effect of A plus B or A drug and B drug will be equal to the individual effect sum of drug A and drug B. So here when we are taking drug A, what is their effect, and drug B, what that is their effect. If we that effects are increasing by or increasing each other action and going to show a total combination effect of A and B, and that is equal to the effect of B and effect of A and B plus sums equal, then that type of interaction or combined effect is called as additive synergism effect. The example is paracetamol and aspirin. In paracetamol and aspirin, the effect of paracetamol and aspirin is almost equal to the effect of paracetamol individually and aspirin activity. That combined effect is equal to the effect of combination effect of drug A plus B. Here is paracetamol and aspirin. And in supra-additives, the effect of drug A plus B will be more than the effect of drug A plus the effect of drug B. So in this, the individual activity of drug A and B action is less than the total action or combined action of A plus B. That means A plus B combination effect will be more than the sum of individual action of drug A and individual effect of drug B in combined. The example here is physostigmine and acetylcholine. In acetylcholine and physostigmine, when they are going to use or administer into the body together, they are going to enhance each other action and they show more effect than the physiostigmine and acetylcholine when they are administered singly without any combination. So that is about synergism. The second type of effect or combined effect that can be showed by both drug A and B, that is antagonism. Antagonism. Here also one patient is taking drug of A and B in combined together. So before that only I told you, in synergism one drug is going to help another drug in showing their action. That means that will helps in increasing action of another drug. But in antagonism, one drug will decrease or inhibit the action of another drug. So here drug A is going to inhibit the action of drug B, and that is called as antagonism. Now that antagonism also is classified into different part, that is chemical, another one is physical, and third one is receptor antagonist. And in that receptor antagonist, it is also two types. One is competitive receptor antagonist or antagonism, and second one is non-competitive receptor antagonism or antagonist, that we are going to discuss in next slide. So in antagonism, you just have to simply remember that the effect of combination effect of drug A and B is less than the effect of individual action of drug A, and the total effect of individual action of drug B. That is the normal equation in case of antagonism, that is effect of A plus B combination is less than effect of A plus effect of individual B. Now is going to the classification of different type of antagonism. The first antagonism we have to study, that is physical antagonism. In physical antagonism, one drug, that is A, is going to show or decrease or inhibit the action of another drug by inhibiting their different physical properties. So how they will decrease another drug action? By decreasing their physical properties like absorption, distribution, then lipophilicity, polarity, like that different physical properties they will inhibit, and that will cause the inhibition of action of another drug, that is drug B. So that type of antagonism is called as physical antagonism. Example is when charcoal and alkaloids are taken in combination, that charcoal will absorb that alkaloid and it will causes the decrease or inhibition of action of alkaloids type of drugs. So charcoal and anti-alkaloids class of drugs are act as antagonism. Here that charcoal will absorb that alkaloid, that will cause the inhibition of action of alkaloid types of drugs. The second type of antagonism that we have to study, that is chemical antagonism. This is like physical, but in that physical, the drug A is going to decrease or inhibit the action of drug B by decreasing their physical properties. But here that action will be shown by decreasing their chemical properties, like by doing different chemical reactions like oxidation, reduction, hydrolysis. Different chemical mechanism or chemical reactions are there. By that chemical reaction, that one drug is going to inhibit the action of another drug. That means that drug A is going to decrease the action or inhibit the action of drug B. Here the example is when you are taking alkaloid types of drug into your body, that drug is going to decrease the chemical action of neostigmine, and this is cause the decrease of action of alkaloid types of drug. So that is chemical antagonism, because hereby decreasing the different chemical reaction or interfering chemical reaction, one drug is going to inhibit the action of another drug. That is called chemical antagonism. The last type of antagonism, that is receptor antagonism. So how that is what, in that one drug is going to inhibit the action of another drug by interacting or binding with a specific receptors. In our body different receptors there that we have already discussed into the receptor chapter, you can go through there. So here what will happen, one drug is going to inhibit the action of another drug by interfering or binding with a specific receptor. Here also antagonism of receptor is going to classified into two parts. One is competitive and another one is non-competitive. Now that specific individual competitive and non-competitive I am going to discuss into the next slide. First one is competitive. By that name only you can understand here that what will happen. Here competition will take place. Just suppose it is an receptor. Now two drug will be there. One drug is like that and another one drug is like that. That is suppose drug A, that is suppose drug B. Now that A and B will do competition with each other, and by that competition that drug what will win will come and bind with that receptor, is going to show their action. So just suppose when that drug B is coming and sit into that receptor allosteric part or active site of receptor, then the action of drug A is going to decrease or going to be inhibited. So that type of receptor antagonism is called as competitive antagonism. So in that what will happen, that two drugs will do competition with each other and will bind with the active site of receptor to show their specific action. The example what we can explain competitive receptor antagonism is acetylcholine and atropine. When acetylcholine and atropine is going to administer into the body for their specific action, that one drug is going to sit or bind with the active site of receptor and going to inhibit the action of another drug, that is acetylcholine. So here what will happen, atropine will do competition with the acetylcholine and that atropine will sit into the active site of the receptor. So by that atropine is going to inhibit the action of acetylcholine. So that is competitive receptor antagonist or antagonism. The last topic or last part of that combination drug effect is non-competitive receptor antagonist. So by that name also you can understand here will be no competition. So here one receptor will be there, that drug is drug A, that drug B will come and sit into that active site of receptor without any competition. So by that sitting into that active site, that B drug is going to inhibit the action of another drug, that is drug A. Here the example you can tell is diazepam and bicuculline. So what here will happen, that bicuculline without any competition, that bicuculline will come and sit into the specific action site or active site of receptor and it will inhibit the bind of diazepam with that specific receptor, and that will cause the inhibition of action of drug diazepam. So that diazepam and bicuculline combination is a specific or perfect example of non-competitive receptor antagonism. So by that, in that video easily in easy way with different diagram and different example. I have explained different type of combination effect of drug when we are taking more than two drugs, that is drug A and B. So that can be effect like one drug is going to increase the action of another drug, that is synergism. In synergism, two part was there, additive and superadditive. And the second one is one drug is going to decrease the action of another drug B. Here that is called as antagonism. That antagonism are three types. One is chemical, based on chemical properties they are going to decrease each other action. Another one is physical, according to physical properties they will decrease the action of each other. And the third one is receptor antagonist. By binding with different or specific receptor, one drug is going to inhibit the action of another drug. And in that receptor antagonist, three parts are there: competitive, non-competitive. In competitive, that two drug A and B will do competition and bind with specific site of receptor and going to decreases each other action. And in non-competitive, without any competition, that one drug will sit into the receptor and that will inhibit or that will decreases another drug or resist another drug to bind with the receptor. By that, one drug will decreases or inhibit the action of another drug. So we have discussed this into the class that I have already discussed in brief last. So in the next coming video, I will be dealing with adverse drug reaction, which is very important. Then we are going to the main part of pharmacology part, that will be drug acting on autonomic nervous system. For today, thank you.